Hello, good morning. I am Dr. Bishyash. I am a doctor of this clinic. May I confirm your name and age, please?
Yes, doctor. I am Rog Hagen, 53 years.
Well, nice to meet you, Mr. Rock again. How can I address you?
You can tell me Rog.
Okay, Mr. Rock. I have got a letter from your GP saying that you had some problem with your memory. Is right?
Yes, doctor. Yes.
I am going to discuss about this condition with you, and I will take some notes during your conversation. But all the information during our conversation will remain confidential. So, is that okay with you?
Yes, doctor. It's completely okay.
Okay. And do you think that you can continue the conversation, or do you want anyone that who can prescribe your condition in more details?
No, doctor. I think I can tell my own doctor.
Okay, so can you please tell me that what has happened to you?
Doctor, actually, what happened is that I have some problem with my memory. I think, doctor, it's just a very recent incident, doctor. Okay. Actually, I started the problem yesterday. That was around, I think, around 9 o'clock in the morning, when I was going to uh, going to going to school. Okay, I am a school teacher. So I just started from my home, and my wife was with me. Okay, and my wife told me that I developed some problem, uh, remembering where I was and how I got there. Okay, it was a sudden event. Okay, and uh, I think I had that continued with that problem for quite a long time, doctor. Okay, and that's what she told me. And actually, from this morning, I am feeling that I am quite okay now. So I am really surprised what actually happened to me, and what's the cause of it, doctor. My wife surely told me that I was abnormal, and I also cannot recollect very much about that incident. Okay, that's really bothering me, doctor.
I'm sorry to hear that. And can you please tell me that how long was this episode persisted? Like 24 hours or less than that?
Doctor, what I think is that I told you I started from home at around 9 in the morning. Okay, but actually, after starting I cannot specifically tell about the timing when it started. But I think in the morning today, I didn't feel that problem. Okay, and I cannot recollect all the events of yesterday. Actually, okay, doctor. So I cannot specifically tell you for how long did this problem continue. Okay.
Okay, so no problem. And before the onset event, what are the last event you can recollect?
Uh, Doctor, I can recollect that I started from my home with my wife. Okay. So my wife decided to do some marketing, some vegetable marketing, and it's on the way to school. And that's what I can remember. But today morning, my doctor told me that after just starting around, after just 5 to 10 minutes, I started having this problem, doctor.
Can you remember that if you had got any injury to the head before the onset?
No, doctor, no.
Any
No
abnormal,
injury, doctor. I don't
any
think.
abnormal shakiness of your body?
No.
And if you don't mind, may I know that what did you eat in the breakfast yesterday before the start of this event?
No, I just normal food, doctor. Nothing unusual or abnormal.
Okay. And in the meantime, did your wife say that you have developed any abnormal shakiness of your body?
No, doctor.
Any problem with recognition of the known person, like your wife or any other known person?
No, doctor. I could. My wife told me that actually I could remember her. Okay, but I was very much agitated, and I was very, very much anxious and agitated, as she told me. Okay. So, and I also, she told me that I repeatedly asked questions where I was. So she was really frightened, doctor.
And did she mention that you could recognize or you could know the routes or paths you follow, or was there any problem with
Doctor, she told me
this
that
place? Yes, please.
Doctor, she told me that I just couldn't remember how I got there, but she told me that I could remember who I was. I could tell me my name, and I also could tell my wife who she was. Okay, so that was all right. That's what she told me.
Any problem with the timing at that time? Just if she has told you that you could recognize it is daytime, evening time, morning time, or night time, if
Doctor,
if anything she told.
Doctor, I don't think she told anything about me, doctor.
No problem. And it is the first time, or you have this episode before?
Doctor, this is the first time, doctor. Previously, I had one problem. Actually, I have diabetes mellitus, doctor, and I take insulin for that. Once happened around 5 years back that my blood glucose level went quite low. So I had some racing and pacing of my heart, some sweating, okay, and some nausea feeling. And then I had one loss of consciousness actually, but that was completely different, doctor. Okay.
And in the last 24-hour period, have you developed any loss of consciousness? Is anyone say to that?
No, no, doctors, no.
Okay. And after getting a more conscious level, that can you remember that? Have you been able to recollect any event of this that happened yesterday?
No, doctor, I cannot recollect now.
And after that, did you feel any abnormal events like any feeling of shakiness, any excessive sweating, or anything else?
No, doctor, no, no,
I'm going to find out that what could be the cause of it. And for this, I would like to know that if you have any headache,
no,
any problem with your mood, any low mood.
no, no, not now, doctor. Actually, but it's true that I have some job issues, and recently I think I have been under some more stress, doctor.
Coming for that later. And I have. Do you have any problem with your vision?
No, doctor,
Any reaction even in your body?
no,
Any? Have you noticed any changes in your weight recently?
no,
Did you have any abnormal events recently, like any fever, any raised temperature, any vomiting, any loose motion, any jaundice?
no, doctor, no, no, no.
How about your appetite and
This is quite good, doctor. It's quite good.
you didn't notice any changes in your weight?
No,
Any? Do you have any hot or cold preferences? Any weather preferences?
no, doctor,
Any racing or pacing of your heart?
no,
Any shortness of breath?
no,
Any chest pain?
no, doctor,
Any lumps or bumps anywhere in your body?
no.
Yeah. And how about your water work
It's quite good, doctor. No problem, I think.
and your bowel habit?
Yes, it's okay.
Do you have any weakness at any side of your body?
No, doctor. No weakness, doctor.
Any joint pain?
No, doctor. No joint pain.
And you said that you have diabetes, right?
Yes, doctor.
For how long?
Doctor, I think I have diabetes for 12 years now.
Do you visit your eye doctors, kidney doctors, and food doctors regularly?
Yes, doctor.
Did they find anything abnormal?
No, doctor. I think I go to them quite regularly, and I had the last insulin change around 3 years back. And since then, I have been measuring my HbA1c level, and they are always quite good. And my diabetes control, I think it's quite good, doctor. Last time I went 3 months back, and they said that it's quite good now, so I can continue with the medication that I have been taking, the insulin.
Can you recent dose changes in your medication?
No, doctor.
Do you have any other medical condition except raised blood sugar?
No, doctor.
Any history of jaundice? Any history of injury to the head in the past?
No.
And can you show me your medication list?
Yes, doctor. It's actually insulin. Insulin mixed 16 plus 0 plus 12 plus minus 2. 30 minutes before meal.
Okay. And do you take any other medication, any herbal products or any over-the-counter medication?
No, doctor.
Do you have any allergy to any medication?
No.
And I'm sorry to ask, but it is important to know that do you take any intravenous medication or any IV drugs, any party drugs?
No, never, doctor. Never.
That's fine. And any of your family member have this type of condition or
Not that I know of, doctor.
any disease that runs in your family, like a problem with the brain, problem with memory?
So no, doctor. No. I don't know.
Can you tell me about your food habit? Is it regular or you are vegetarian or anything? Any special?
Oh, nothing specific, doctor. I am a quite a normal person, doctor. Normal food.
And is it okay if I ask you a few personal question?
Yes, doctor.
Do you drink alcohol?
Yes, doctor. Yes.
Can you tell me that how many units?
Actually, doctor, I'm sorry to say, but it's actually my habit, doctor. Sometimes I have some binge drinking, doctor. Uh, that's I'm sorry to say, but sometimes I have some problem with my drinking.
And before the onset of this symptom, did you drink? Did you take any binge drinking?
No, doctor.
Actually, drinking is injurious to health and also related to some conditions of your body like diabetes. So I would like to recommend you stop drinking. And if you need help, I can refer you to the alcohol cessation clinic. Okay.
Okay, doctor.
Do you smoke cigarette?
No.
2 minutes remaining. And you said that you are a school teacher, and anything that you need, any adjustment at your school, or any support from us for your new job.
No, doctor. I don't think I need support. I'm quite well supported, doctor.
Do you have any history of recent travel outside the country?
No.
Okay. And do you drive?
Yes, doctor.
Okay. And may I know that uh, if you need, do you need any family support or you need any social support or any other support to your home?
No, doctor. No.
Can you tell me that what is your concern?
Well, doctor, what is this? What is that a thing that happened to me, doctor? Is it something serious? Is it a stroke?
As I have taken your history, I need to examine you, then I could give you the best explanation. But as I have taken your history, it seems likely that you have a condition called transient global amnesia. Have you ever heard of it?
No, doctor. No, never.
Actually, in this condition, the no cause is found. This type of patient suddenly develop this type of symptoms. They can understand, they can know the known person, like the relatives, but they make some problem with knowing the places, knowing the time, and it persists sometimes up to around 24 hours or a day. And after this event gone, they are completely normal. And it is not sure that if it comes again or not, but it is nothing harmful condition, and it has no specific cure that can uh, prevent this condition. But it is not likely to the stroke, or not related to the stroke. However,
Mm.
we need to examine you, and after that, we may need to run some blood test or and some imaging test.
Okay, doctor.
Do you have any other concern?
No, doctor. Well, doctor, will it happen again, doctor?
It is not quite sure that it will happen again or not. But if it this again happens again, we will give you the emergency contact number. Then any of your family members can contact the emergency department, and if you need help at the time, we can take care of that time.
Okay, doctor. Well, what do you think your what examinations would you like to do in this patient?
First of all, I will go for the neurological examination. For this, I will go for the hands for checking an RBS pricking mark, then pulse, and after that, I would like to measure the blood pressure. Then I will go for the eyes for any problem with the vision, and then I assess the visual field. After that, I will go for the cardiac if there is any murmur is present or not, and after that, I will go for the plantar reflex if they are plantar flexor or extensor, and then I will assess the zarks of the lower limbs and also the gait. And in the meantime, I would also like to assess the mini mental scoring system.
Okay. Okay. So what do you think your diagnosis is?
For this gentleman, my probable diagnosis is this is a case of transient global amnesia.
Okay.
Other
Do you
differentials,
have any differentials?
yes, other differentials can be as his beans drinkers, so that it can be a case of alcohol intoxication. Then it can be a presentation of post-shock psychosis, though unlikely. Then it can be a presentation of electrolyte imbalance, and can also be a presentation of hypoglycemia.
Okay. So what investigation would you like to do in this patient?
I will go for the complete blood count to see white blood cell anemia and white blood cell count level. If they are raised, then inflammatory markers after the liver function test, renal function test, even for routine examination. Then random blood sugar level and HbA1c level. And after that, if it is suggestive, then I will go for the serum vitamin B12 level and CT scan of the brain.
Would you like to do ECG or electron EEG?
Um, at first instance, I will only go for the ECG, but EEG, I will not go for the EEG at first instance.
Yes, 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 very, very. Okay. So, what do you think? How would you manage the patient?
This is actually educating and counseling the patient. Then management is teaching his family members about this condition, that it is a benign condition, it is not harmful. And if anything happens this again, then they can contact the emergency department so that we can keep him under monitoring again. And no special advice except alcohol cessation, and he has stress at job, so any adjustment at job, except those no special management is required, I think.
Okay. Okay. Thank you. Thank you. Doctor, thank you. So, would you like to add anything?
No.
I think very well. Okay. So, thank you. Will you stop the recording?